And slide 2. So it's hosted, as I said, by NAMI Urban Los Angeles, Gail, of course, and myself. Also with us today is James Kwan, Deputy Director of the Office of the Public Guardian, Linda Boyd, Department of Mental Health Supervisor, Assisted Outpatient Treatment Team. She's going to be talking about various items that parallel what we're going to cover today, and you'll not want to miss that. So next slide, please, Araceli. This is our contact information. You need to get a hold of Gail or myself, or even James Kwan or Linda Boyd. This is how you can get in touch with us. If you're having challenges, you're stuck. I get families calling me, trying to figure out how to resolve a dilemma, and that's what we're here for. We're here to help you guys through this. Next slide. And we'll show our contact information later on as well. So what we're going to talk about, as I had mentioned, is involuntary mental health treatment. And the essence of that is medication. When you're looking at someone that has a serious mental health issue, the really most important thing is to make sure that they don't go off their medications. And that's something that the courts won't allow. So that being said, the only place that we can force somebody to get back on their meds and regain their clarity of thought and mind is when they're in a designated mental health hospital. And so we just want to maintain that their medication is taken so that they don't go off the deep end and injure themselves or somebody else or get lost or run away. So that's really the primary point. And slide 5, please.
Okay, basically, we believe that everyone has the right to be well. The LPS Conservatorship, basically, it's a tool to mandate people take medication, which gives them the clarity of thinking if they have the right medication. If they don't have the right medication for them, they don't have the chemicals in their brain to make those neurons connect. So medication is a key source on helping them to get their lives back. LPS is just a tool. Linda Boyd's going to talk about AOT and Care Court, which are some other tools. And then we also have a home team if somebody's homeless and you know where they are. The Department of Mental Health can go out and help them. We are very fortunate in Los Angeles because Department of Mental Health is really working hard and putting programs in to help everyone. The problem with the other programs, they don't force medications, but the people they hire and train are very versed and they do a pretty good job convincing people to take medication. So we're very fortunate to have DMH on board with all this. Not all counties are on board in making a difference in a person's life. Next slide. Basically, when you're seeking treatment for your loved one, your resources that will help to get them the treatment would be SSI, Social Security income, SSDI, Social Security disability income if they have a work history that's, even if it's a long time ago, they can get that, or Social Security. When you call Social Security, they will give you the guidance as to which direction your loved one would go if you have their Social Security number, because they have all the records, all their work history way back from when they were young or whatever. That's income, and approximately $1,000 a month is given to them. It varies, which is used for their benefit. If they're put in a board and care or a facility, they will often increase it a little bit. Okay, Medi-Cal and Medicare are their resources, their insurance. And you could probably also have private insurance. The one thing you don't want to do, don't start telling the hospitals and different people, well, you have money and you can pay for this. Now, if you're a billionaire or a multimillionaire, go for it. But Once you start saying, well, I'll pay for this and I'll pay for that, this is a lifetime illness. And I will guarantee you, they will suck you dry, kiss your vacations and your retirement goodbye. You won't have it more because they will use that money first. So don't use your money. The county has pretty good facilities. I mean, you could go to a high-end facility that you pay a fortune for and probably not get any better quality of treatment than what you do if you go to a county facility. But keep in mind, there's some county facilities that you might want to be a little bit cautious with. Next slide. This is your SSI, SSDI. You do not need to have an LPS conservatorship to apply for this. But when you call Social Security, what you do, especially if your loved one's in the hospital, that's when you call especially. Do not call Social Security and say, I am applying for SSI or SSDI for my loved one. If you say that, they're going to say, ma'am or sir, you can't apply for this, and they'll hang up. Good, that ends your conversation. Say, I would like for you to help me fill out the forms. My loved one's in the hospital or they're going to the hospital. Get them to help you fill out the forms. When they are in the hospital, give those forms to the social worker to get them to sign it. They're pretty good about getting these people to sign it. Medi-Cal pretty much comes automatically with SSI, but you can always get an emergency Medi-Cal if they're in the hospital. That helps pay for their hospital stay. Now, Medicare is usually granted 2 years after a person is under Social Security disability income. But if they've been ill for 2 years and you don't have Social Security disability, but you have proof they've been ill for 2 years, give that information to Social Security and chances are they will approve Medicare at that time. So you hear people talk about Medi-Medi, they have Medi-Cal and Medicare, and you can have both. So the more the merrier. And if you have private insurance, some people will tell you get rid of your private insurance. You don't have to. You can have Medi-Cal, Medicare, and private insurance, and it helps to pay for a lot of things. Okay, next slide. Oh, one more thing. When you are applying for, when the person's in the hospital, ask the doctor or the social worker to get the doctor to fill out the form for you to be the representative payee. One of the easiest things you'll be able to do. The doctor fills it out one day, gives it back to you. You give it to Social Security, open up a bank account in both your name and your loved one's name. It is recorded to the IRS as their income, but only you have control of that money. Now, if you tell them what bank it's in and give them the account number, they'll clean it out in a heartbeat. So you don't want to do that. You just kind of want to be a little bit mum about where that money is. It will be direct deposit into that bank account, and you have control of it for using it for their needs, for their housing, their food, if they need clothing, whatever they need. Next slide.
I just want to, before I start this slide, I forgot to mention that if you have questions, you can type those questions into the chat box as we go along today. So getting back to this, one of the things you want to do as you're taking care of your loved one is to keep a powerful, concise case for treatment. You want to keep a journal and make sure that you're logging in the medications. We're going to go over this in a little more detail, but you want to create a case as though you were an attorney trying to fight a court case. And what you're trying to do is to show that your loved one really does, in fact, need to be on a conservatorship with their serious mental illness. That being said, what you'll do is you'll want to create and put it together in such a way that isn't too overwhelming for a doctor to look at. And we're going to show you how that's done. So next slide. What you want to do in this is you want to you want to use this case, excuse me, it's been a while. You want to use this written case anytime that you are trying to acquire SSI, SSDI, or Medi-Cal. This mental health history and treatment, hospitalizations, and so forth is something that you can show as verifying that your loved one actually does meet eligibility for these types of services. Another case where you want to utilize a mental health written history on your loved one is when you're requesting the police or psychiatric team to hospitalize the person on, let's say, a 5150. So one of the little side notes that we'd like to bring out is that you want to keep copies of this hidden away, maybe tucked under the lining of your trunk of your car, one at the hospital, one at work, one at home, someplace where no one's going to stumble over it. And if you find yourself, whether you're at home or you're someplace out on the road and your loved one really has become unstable and that the treatment team arrives, you'll have that information with you and you want to present it to them so they can get a further grasp of what's going on. Next slide. This is an example of how that mental health history should be put together. You know, we just don't have the luxury of time when we're trying to talk to the mental health team that comes out to do an evaluation or other situations like that. We can't just hand the doctor or the CAT team, 6 pounds of past mental health histories from all these hospitalization forms and so forth. They don't have time to read that. So we want to put this all together onto a single piece of paper whenever possible. And the way that you would start that is that you want to put down the dates that they were hospitalized, where they were hospitalized, the diagnosis that the doctor in the hospital was able to come up with. And of course, if they have any allergies to medications, as it is down here at the bottom of that single page, you put a note not to give Bioxin or Haldol. He has diabetes, or he has Blue Cross insurance, SSI, Medicaid, applied for Medicare. Any information that's going to help them when your loved one goes to the hospital to know where he's at financially, what medications not to give him. For an example, sometimes when you give Haldol to somebody, it makes their tongue swell up and cuts off their airways. Critical important to put in there. Next slide.
Yeah, can I just add something? I would suggest that you use this exact format. Don't be creative. Only put 4 things on the history. This is the first page, the history. Only put their first and last name, no social security, no birth date, nothing else that can identify them, no middle name or middle initial. And then put the 4 things. The event would be hospitalization, homelessness, or incarcerated. The date as best you know it. Sometimes it's just the month and the year, and do it in chronological order. As things occur, the area, if they're homeless or if they're hospitalized or incarcerated, the facility, and the diagnosis. There is always a diagnosis. If you look at 3, homeless, exhibiting psychotic behavior, they're not doing research out on the streets. They're exhibiting psychotic behavior. Just put that down. Don't put, well, they were there because of so-and-so and the doctor gave them this medication. Keep this simple. Then on the bottom, you're going to put their medical problems. But at the bottom of that page, if you want to, it's not a bad idea to write 3 open-ended questions. And we will talk about this again in this presentation. Things that will set them off. NAMI will say, oh, well, you want to de-escalate the situation. If you're trying to get them in the hospital, no, you don't. You want to show them that they do have a problem because they can pull it together. You've all seen that. They pull it together and they're just cool as they can be. And you're going, what gives? 2 minutes ago, they were all over the place. Questions that are not a yes and no question. Something like, I understand the FBI's following you. How can we help you with this situation? That will get them to talk. And we'll go into those questions a little bit later. But this format, we've been told over and over, everybody appreciates it. They can look at it in 3 seconds or less. They know what they have. So if you can copy it, paste it from the website. It is not a PDF, so you can correct it and make it for your own. Okay, next slide.
So again, as Gail had intimated, you want to include their medications and allergies on the bottom of the page, medical problems and resources, so forth, and what insurance they have. We've covered that. So let's jump to the next slide. On the back of that, again, single piece of paper, that's the goal, is you want to write the symptoms and characteristics. What is it that they are exhibiting that makes you know that they're at a point of non-stabilized in their thinking and their thoughts? And you want to share that with the doctor or the assessment team that's coming out. What is going on with them at the moment, like right now? They're seeing ghosts, they see dead people, they see people with pointed chins and beaked noses. I remember one of the parents saying that their daughter was given a medication and she was asking her dad why his arm was coming out from the middle of his chest. She was hallucinating. Other auditory hallucinations that you want to bring to light is the fact that they seem to laugh or smile for no apparent reason. It might be thinking that the television's talking to them directly, and so forth. They may have delusions. They feel that they see Christ, or they're going to start a major cash empire, and they're all going to be rich. The whole family's going to be able to retire and enjoy life on a big ranch somewhere. These are all delusional kind of remarks that are very insightful as to what's going on with the individual. They may go to the hospital and they feel that they can raise people from the dead, and so forth. You can read this, but they're just not able to make sense out of the conversations. One of the things that Gail has listed here is rapid speech. And I know that when I've been in a hospital setting and seen other people around me, there was a young lady that spoke with such rapid speech. I couldn't believe that her brain was capable of talking that fast, nonstop. But this is what happens when they become destabilized and off their medications. So this is what you would want to list on the back of that mental health history so that they can see what's going on. And because I think it was Assembly Bill 1424 written by Carla Jacobs saying that the family has the right to provide this information to anyone that's on the evaluation team, the CAT team that comes out here in Orange County. They call it differently in LA. But you have the right to present this information to those that are going to do an assessment. So it's very, very important to follow this format. It's very effective. Next slide. Gail?
Disorganized behavior. These are, when you're putting these symptoms in, only use phrases. The doctors have heard it all before in one form or another. And so the phrases help them. They can look at it. If they have questions, they'll ask you. Don't count on that. But if they do, if they're really getting into this, they will. Don't say anything positive. Just not until you have that LPS in your hand and they're doing well, then you can start saying things positive. In fact, once you get the LPS, we suggest that you go back to your photo album, look at the pictures of, remember what they were like before they got ill. That's your target goal, to get them as close to that person as possible. But these are things that they do. The hygiene, they go for days without showering. They smell bad. They dress inappropriate for the weather. There's all sorts of things. Don't brush their teeth ever, which is really bad. Some things run through everybody, and I think we have a slide on this. People with serious mental illness, when they're exhibiting psychosis, they may become very racial against everybody who's not them. One lady was very upset because her son hated Black people, hated them. And she said, I don't get it. He's Black. But it doesn't matter. It's everybody who's not them. Sexual hallucinations, they get some really wild ones. We had one fellow who was expecting twins the next day, a lady who was 64 years old, she was pregnant and going to have the baby within a few days or something like that. So they come up with weird things. When you're talking to your loved one, keep a journal and write these things down. Don't correct them. Now, you can say, I'm sorry you feel that way. That must make you feel very uncomfortable. But if you start correcting what they say, they will clam up and they will not tell you anything else. You need to know where their thinking is at all times, even in the recovery. So this is important. Don't, whatever you do, don't correct it. Just write it down later on when they're not around. And you can make a comment, that's got to make you feel very uncomfortable. I know it makes you uncomfortable too, but I think I would leave it just to them. They throw food in the garbage because they believe it's poison. That's real to them. It's not to you, but to them it's real. Destroying their cell phone, electronics. Many times they won't watch TV. They won't listen to a radio. People will say, well, I give them a cell phone. Let them get the Obama phones, those freebies, because they will throw them away because it's either sucking things from their brain or filling their brains with information. Okay, next slide. Behaving in accordance with their paranoia, things that they do because they are paranoid. Sometimes they believe they're married to a movie star, so they'll stalk them. That's behaving in accordance to that delusion. So be sure you can put 2, 3, 4, 5 symptoms. If a category doesn't apply to your loved one, delete the whole thing. If you have a him, her, and you're talking about your daughter, delete the him or vice versa, whatever it may be. If you leave that, when the doctor's looking at this and he sees a him, her, this is specific for your loved one. They will, as far as they're concerned, they'll just chuck the whole thing. They copied this from someplace and they'll just let it go. So this is specific to your loved one. A lot of the symptoms you'll say, oh, they do that. That's fine. You can use it. But be sure to put symptoms pertaining to your loved one and only phrases. Now, your history should take 1 page and your symptoms should take 1.5 pages. So now you're at the bottom of the 3rd page, which is gravely disabled. Next slide. Okay, this was a few things. We'll talk about gravely disabled in a minute, which is also supposed to be on your case that you put together. Important tips. This is for this year. Next year, this is going to change because the law has changed. But in Los Angeles and Orange County, they are still using the old law for gravely disabled. If you talk about substance abuse when they're in the hospital right now, the doctors will say this is a substance an abuse problem, so we're going to discharge them. That is their key to get rid of them. Next year, as of January 1st, 2026, that will be considered part of gravely disabled. If they are violent towards somebody, don't mention that they are, because now they become a liability. And they're like that when they're ill. Once they're in treatment, they don't tend to be like that. But once they become a liability, it's very hard to find a treatment facility that can take them because of their insurance. It's hard to find something. Now, you can state they're highly aggressive towards people walking the street or towards their mother or something like that. You can do that. When they are in the hospital, and this is because it's this year, do not say they can come home. That's a trick question that the hospitals will ask you. We're going to discharge your loved one at 3 o'clock. Will you be picking them up? The moment you say yes, but you say, but we need the LPS conservatorship. I'm sorry, but they don't qualify for it because the old law, which they're still going by, is they cannot provide for their food, clothing, or shelter. But if somebody else provides it, they are not considered gravely disabled. And that is what the hospitals are still going by. So you have to say that. Now, if it were my kid, I'd be sitting in the parking lot because I know darn well that hospital most likely will still dismiss the patient, discharge the patient. So I would be there, because I don't want them on the streets, and I would bring them home, but I would call the police and get them put back right back in the hospital again, as soon as I possibly could. Okay, next slide. These are the common symptoms: racial against everybody who's not them, heightened sexual delusions. Don't be surprised if they say you've molested them or, just weird things. If you can pretty much tell if something's true or not. If they give you details, I sure as all heck would be checking it out. But if well, it happened. It happened. They're just giving you generalizations. They don't really not able to give you details. And usually that's because that's delusional. The FBI, CIA, other people are following that. They're not ill, but everybody else is. The police will come and they'll say, yeah, my mom has a problem. Don't even be surprised if they call the police to have you put in the hospital. That's happens too. So stay calm. Whatever you do, stay calm and explain what's going on. Next slide.
So if you want to define, what exactly is gravely disabled, it's a person who has a serious mental illness. And because of that, they cannot provide for their own food, clothing, or shelter. So it doesn't have to be all three. It's any one of those. If they are incapable of providing for food or clothing or shelter, then they meet the criteria of being gravely disabled. But at the same time, if somebody else can provide for their food, clothing, or shelter in a safe manner, then they will not be considered gravely disabled, and the LPS conservatorship will not be granted. One of the things in regards to this center one here is my son was signing up, or actually he was fighting his renewal of conservatorship. He wanted to get off of it. And the public defender's office called me and they said, Mr. Farrell, if by some chance your son were to be removed from conservatorship, would you as his dad continue to provide for his needs and help him out with whatever it is that he needs? And I said, absolutely not. Not that I wouldn't, but that I continue to say to her, if I then step in and continue to provide those services for him, then he no longer would be gravely disabled and no longer would be eligible to remain on conservatorship. And I heard this gasp. Know that a lot of times this is something that the public defender's office will try to get you to say, or even a judge one time tried to get me to say, oh, well, sure, of course I'll provide for his food, clothing, or shelter if he's not able to do it. And if you take him off, yeah, I'll help out. I'll take care of him. He's going to take him off of conservatorship at a time when he needs to be on it. So don't fall for that. Be aware of it. Make notes on that. Next slide. In regards to shelters, you want to stress that they may not come home and live, with you and your wife or whomever, and that they have no place to live safely. That they cannot handle a shelter or board and care safely. If they get into those environments by themselves, they cannot live there, as you say, in a way that's safe, that they will wander off, that they will do things. They really need oversight with somebody to look over them. You want to point out that your loved one has lost significant weight from not eating. They're paranoid of food, or they're being poisoned, or they're grossly overweight because of compulsive eating. These are all things that would indicate that they need to be on a conservatorship. If they take their clothing off at inappropriate times and places, they wear clothes for excessive periods of times, or they smell bad, they have just filth all over their clothes, or they dress inappropriate for the weather, they're a health risk. So how many times have I seen individuals that, especially the younger generation, right, or even the 45 years of age, be a hot summer day, they want a black hat on, baseball cap, they have on 2 sweatshirts, black pair of pants, and I'm thinking, good gravy, this is what happens. They just cannot get it in their mind that they're overheating, and that can pose a real serious health situation in their case. These are all things that indicate that they are gravely disabled. Next slide. Thank you. So what you want to do is you're really going to do a very acute evaluation as a parent or a member of the family structure. And you're going to try to decide what is the best direction for treatment of my loved ones. What are his or her needs? What is best going to fill those needs? And so you're going to look at the recovery model. I've heard less than favorable accounts of full service partnerships in LA. I don't know if that's true or not. In Orange County, it's hit and miss, but there's been times it's been really excellent. And that is that in a full service partnership, they contract with the county, and they provide counseling and therapy and so forth. Here in Orange County, they used to dispense the medications while they were there, and they go there like every day. They no longer do that. Or perhaps they need to go to care court because of their mental illness. Maybe they've gotten themselves in trouble with the law and so forth. So they would go to care court, and Linda is going to be talking about that with us later on in the day. Or perhaps maybe they're best off with assisted outpatient treatment, which is called AOT, and that was fashioned after a young lady who unfortunately met her demise from somebody that was mentally ill and knocked her off the railroad track, and she was killed by a train. And so they have now this whole program that's set up in memory of Laura to help with their treatment. They may not quite qualify for conservatorship, so then they have what's now called AOT, assisted outpatient treatment, and that is very effective, and I'll not talk on that because Linda will be. And then fourth, also, you can look at what they're doing. They're not compliant to taking the medications. They're not compliant to going and seeing the doctor, going to a treatment team or FSP or whatever it is that you have them doing. And the only way that you can best control that and help them at the same time with all of their banking needs and take them shopping and all the rest to make sure they're eating well and all of that is to have them on an LPS conservatorship, which is involuntary treatment. They can't say, gosh, that sounds good, sign me up. That's when they're so mentally unstable that they require that kind of oversight. It's an involuntary situation. I had a psychiatrist actually call me on behalf of one of his clients that was actually in session with him, and he kept saying, I want to be on conservatorship. I need a conservatorship. And the doctor called me and said, is this something that we can do? And when I explained to him it's involuntary, then I made some other possible referrals to them. Next slide. Gail, this is yours.
Well, that's okay. When you're trying to get your loved one hospitalized, if they tend to be harm to self or harm to others and a flight risk or a flight risk, you can call 911 and get the police to come out, but ask them to bring an evaluator for mental health at that time and demand that they take the person to the hospital, not to jail. Now, if you have a restraining order against them, the police don't have any choice. They have to take them to jail. Don't freak if they go to jail. We can get treatment when they're in jail. But be sure to ask them to bring an evaluator. If they're basically gravely disabled, they're not leaving their bedroom, they are really not eating, losing weight, and a variety of things going on the gravely disabled side. Remember, it's food, clothing, shelter. Then you can call Access, and their number is there, and Access will come out there, and you can ask them to bring the police if they're a flight risk, and they can help to get them in the hospital. Now, the problem that we're having right now, if they're willing to get on the gurney or in the back of the police cruiser, not a problem. But if they say no, the police in Los Angeles, and correct me if I'm wrong, Jim, in Orange County also are saying, we're not putting our hands on them. Well, the sickest of the sick need their hands on them to get them in these facilities. So that's really a problem. And we had one girl who was working with the SMART team who would make it happen, but right now she went on to law school or to go get another degree, and so we kind of lost her. But that's a difficult one, and I'm really stumped on what we can do on that. Right, those three open-ended questions I told you about. Usually when the police come or Access come, they will meet you outside the house, maybe a few doors down or something. And you can kind of tell them at that time, ask them this question, give them three, because if one doesn't work, hey, try another and try a third one if necessary. Those questions are really important because it does get the person to talk. You know, the FBI, I understand they're following you. What can we do to help you? Or I understand that you're married to Greta Garbo or something. And how can we help you with that situation? There's a variety of things, but they're open-ended questions, and that would help. So, by the way, I'm going to go back to gravely disabled. In the packet, which you can get it off the resource for NAMI Urban LA, in the resource, there's an LPS info. There's a section which has gravely disabled written out. Connie Drexler, who used to be the director of Public Guardian, she and I sat down and wrote it out. Food, clothing, and shelter apply to safety or health risk. Use it exactly like it is. I mean, we were very careful about the verbiage, how it was written. Delete what does not apply. And be sure that this is specific for your loved one. But that gravely disabled helps the doctors to be able to write up a stronger case for treatment, because now they know what they're dealing with and they can ask you the appropriate questions. Okay, next slide. Hospitalization. This is generally, if you've not had anybody hospitalized, this is the way it runs. You have what they call a 5150. It's also known as a 3-day hold or 14-day hold. Well, the 14-day hold is your 5250. That shouldn't have been on there. And the 3-day hold or the 5150 is when they will evaluate a person. When they go to that hospital, that history, symptoms, and gravely disabled that you showed to the police or gave to the police, do not assume they take it to the hospital and give it to the hospital. Most probably they don't. Ask them where they're taking your loved one. That is civil. The police can tell you. Once they cross the threshold to the hospital, it becomes a little bit more difficult because now we're dealing with HIPAA. But take it to the hospital, to the emergency room, give it to who's ever going to evaluate your loved one, because that helps them to understand what's going on. When they walk in the room, your loved one's going to be just perfect. You know, yes, sir. No, sir. I don't know why my mother had me do this. She's going crazy. You know, you just have to be patient with my mother, kind of thing. But this will help them to be able to establish what the situation is. Then when they transfer them to a hospital, don't assume they've sent that paper. take it to the hospital where they're on the 14-day hold, and give it to the hospital, to the social worker to give to the treating doctor. Okay, within the first 4 working days, and hospitals now count weekends as a working day, they have what they call a probable cause hearing or a certification hearing, depending on what hospital you're dealing with. It is after that hearing that the doctor, if they're going to initiate the LPS conservatorship, they will do it at that time. They don't tend to do it beforehand, because if the person wins the case on the probable cause or certification hearing, then the hospital has to release them, and they've done a lot of paperwork. So they kind of wait till after that hearing, but you want them to do it right away after that hearing, assuming they've decided that they can keep your loved one for the full 14 days. That's what that hearing is about. Now, hospitals tend to not keep them for the full 14 days. They tend to discharge day 11 or 12. So don't say, well, they have to keep them all 14 days. No, they don't. They can keep them up to that time. The hospital can also continue to keep them for an additional 30-day on an intensive hold. That's at 5270. They can keep them on that. Now, if the doctor has written the case for an LPS conservatorship, the public guardian is the conservator. This is also referred to as a TCON. And the public guardian will basically be in control of things. They don't mandate medication at this time. So if the person takes medicine, fine. If they don't, it's what it is. If they're acting wild in the hospital will tend to order a rehearing where they can force medication, but it's really only for a few days, enough to calm them down again. If the doctor's initiated the LPS conservatorship and your loved one is all over the place, and you're going, they really need to give them medicine to straighten them up and all, count your blessings if they're all over the place, because now when they get to court, it's pretty apparent they need it. Okay. Next slide. How to acquire the LPS conservatorship. You do not apply for the LPS conservatorship. The practice is only the treating doctor at the hospital or the jail who can initiate the conservatorship with the public guardian's office. This is not the law, but it is the practice. And the reason why, there's a lot of paperwork that goes in this. When the doctors initiated the LPS conservatorship, and it's not a doctor affiliated with a hospital or a jail, which are locked down facilities, and the doctors initiated it, and the person doesn't show up in court, case is dismissed. So that's why they use only the treating doctor at the hospital or the jail who tend to initiate it. And the public guardian, that's what they will accept. They have to approve this, and then they send it on. And James Kwan will be talking about that shortly. Okay, generally they are hospitalized, and that's when you do it. Okay, next slide. Okay, give your written case to the treating doctor at the hospital, or if they are in jail, give that written case to the treating doctor at the jail and request that the treating doctor initiate the LPS conservatorship. If they do go to jail, they have what they call a jail diversion program, which is about 2 years. And this is almost like your insurance policy, that they will be able to follow through with that program, because now they've got the medication in the brain to make those neurons connect properly. When they're not connecting, you're going to have things like it's hot outside. They might, turn the air conditioning on, but open up all the doors and windows and start putting on a sweater, sweatshirt, hood. The neurons aren't connecting to the proper neurons. So they do need those chemicals in their brain so that they can think clearly. So be sure to request the doctor initiate that LPS conservatorship. And remember, they're not going to do it till after the probable cause hearing, which is about 7 days after they've been hospitalized. Next slide.
I just want to,
Go ahead, Jim.
well, I guess something's come up in front of